The Palmer Drug Abuse Program, commonly known as PADAP, was founded to provide an age-appropriate support group for adolescents and young adults with substance abuse problems. Many of these youth have not crossed the line to full addiction, but would benefit from the tools and approaches used by 12-step programs. PADAP was established to provide a safe and healthy environment for youth to achieve sobriety and change. We provide support groups for youth to discuss issues with same-age peers, social activities that act as their alternatives to their old lifestyle, and leadership skill development to help them not only recover, but excel. The staff of PADAP provides the insight, counseling, and enthusiasm needed to motivate the youth into a new way of life. In the coming years, PADAP seeks to achieve 3 goals. 1. Expand to underserved communities in Houston, especially those in economically challenged areas. We're currently working with several organizations to accomplish this goal. 2. We are working to increase our ability to provide specialized prevention services to middle and high school groups. These represent the most challenging age range to reach, and PADAP provides youth with realistic information about drug use and its consequences. We have ongoing training for staff members, and we've established a community outreach committee to train volunteers in prevention and intervention services. And finally, we seek to expand the resources offered for youth as they progress in their recovery. PADAP offers specialized groups that focus on such concepts as thinking and judgment errors, self-esteem, feeling management, and other areas that are essential for long-term mental and emotional health. We offer the youth support services that help them transition into a new way of life. Change is a process, not an event, and PADAP provides that young person with the structure and support to make the changes to lead a healthy and productive life. The alternative peer group approach is innovative today, but was implemented by PADAP 40 years ago. Because of our effectiveness with youth, the community recognizes our program as one that is critical to the continuum of care for those regardless of their level of use or abuse of mind-changing chemicals. PADAP utilizes approaches and strategies that naturally engage the youth in the recovery process. Our approach was considered innovative 40 years ago and is still considered innovative today. We use a social model coupled with a modified 12-step program that is age-appropriate and youth-driven. The program is confidential and anonymous, both of which are critical to a young person's ability to trust, recover, and change. And lastly, the success of our program is tied directly to the fact that young people enjoy participation and feel empowered to take charge of their lives. PADAP measures success by analyzing a variety of data. One measure is the number of youth obtaining 30 days of sobriety and tracking the client's length of sobriety. The second measure is compiling data on the changes of attitudes and behaviors of clients using an industry-standard assessment tool that assists us in the types of intervention needed for individual clients. Additionally, we conduct quarterly satisfaction surveys with youth and their parents. Another measure is relapse rates. Nationally, there is an 85% relapse rate for substance abusers, with most relapses occurring within the first 90 days, which means nationally, there's only an average of a 15% recovery rate. The Palmer Drug Abuse Program has an average 72% recovery rate. The statistical significance between these numbers indicates the effectiveness of the innovative approach of the PADAPT program. Many people consider us a drug abuse program. We are a recovery program. Our goal is to teach youth how to stay sober, develop healthy coping skills, and create a productive, positive lifestyle. There is a stigma regarding the types and kinds of people who use and abuse drugs and alcohol. Substance abuse affects all levels of society and all races and ethnicities. There is a stigma to recovery. The individuals who need help must be addicts or weak because they just don't say no, with the belief that once you reach 30 days of sobriety, you're cured. The reality is that those who achieve 30 days of sobriety, whether they are an addict or a user, need at least 1.5 to 5 years of assistance to achieve the maintenance phase of recovery. Substance abuse is a relapse disease. Not everyone that attends PADAPT is an alcoholic or an addict. Some are experimenting with drugs due to a belief that it's a rite of passage, and others to fit in and be popular. Most of those entering our program are substance abusers. If they receive help now, they become adults without abusing drugs and alcohol. Our clients stand a good chance of never developing chemical dependency or addiction. Because we work with youth during the critical period of vulnerability of adolescence, we are able to intervene before it affects their adult lives. The majority of substance abusers began their abusing during adolescence. PADAPT is not where all the bad kids go. All youth are susceptible to substance abuse. Our clients come from all different types of families and situations. The one trait they have in common is they have a desire for change in their lives. Our youth come from all races and ethnicities, are part of families of all economic levels, families with strong parenting skills and families that need guidance, and youth with different levels of use and abuse. Substance abuse is its own issue. In reality, many times substance abuse is the basis for other social issues like domestic violence, homelessness, crime, divorce, mental illness, and joblessness. The Palmer Drug Abuse Program, by working with youth and their families, affects current and future rates in other areas of societal needs. Substance abuse is not decreasing. The need for the Palmer Drug Abuse Program continues to increase because of street drugs being readily available, easy access to prescription drugs, and the development of synthetic drugs. The greatest accomplishment for a PADAPT is creating an entirely new and innovative approach to youth substance abuse. The program is a bridge that helps youth with continued sobriety so they can walk down the path to a healthy lifestyle. We are also the only free program in the greater Houston area and have been for 40 years. We are completely underwritten by the community and limited to the number of youth we serve only by the money we receive to provide our services. Anyone can come to our program regardless of his or her economic level. Additionally, we're a cross-generational program where our strategies for helping youth are just as applicable today as they were in 1971. One of our greatest accomplishments is the hope we give to youth and their families. There is a tremendous amount of need in the nation and in Houston for services assisting youth with drug or alcohol problems. One of our greatest challenges is finding the funding to meet the needs of the Houston community. Additionally, providing satellites in underserved areas where transportation is an issue for families, and finding a facility to provide services in these areas is a challenge. Another obstacle is the stigma about recovery. It's a challenge we face because many people who will fund other social programs don't believe that substance abuse recovery is a needed service. Many people do not realize the devastation substance abuse has on the family and community. They think that abusers should deal with their challenges on their own and that it isn't a societal issue. We would jump with joy. Even though we already provide services to youth at several satellites in the greater Houston area, there are many underserved geographic areas in Houston where we need to open up satellites to serve youth who don't live close to one of our existing satellite locations. It's common to receive requests at least once a month from different groups who beg us to open a satellite in their area of town. We explain to them that we need sustainable funds to open another satellite due to the nature of our program. These requests come from school administrators, community leaders, government leaders, church leaders, parents, and treatment programs who know youth are more successful when attending our program. Some of the youth themselves travel 20 to 40 miles or more to attend our program, even through big city traffic. We'd also hire more personnel to assist a passionate staff. PDAP employees are committed to their role in supporting youth. There are other strategies we could implement that would increase our sobriety rates and support the effectiveness of our program, but funding is limited for adding staff for supplementary services. Another area where additional money would be utilized is broadening the services and the types of activities that we provide for clients. Because many of our clients come from economically challenged families, we rely on the generosity of donors and parents to provide the funds for these activities. Entering our 5th decade of service, PDAP continues to provide a variety of services to Houston youth. At this time, we provide more intervention and recovery services than prevention services. By being able to raise funds to hire additional personnel, it would allow us to create more school groups and make more presentations to youth about the harmful effects of substance abuse. Additionally, we'd like to provide more Stage 2 recovery services to youth. Some of these would include stress management techniques, relapse prevention strategies, feeling management skills, and critical thinking tools. And we'd like to expand the family services component of our program. More personnel are needed to provide workshops and activities for families. Some of the topics would cover family education about chemical dependency, family systems, communication skills, conflict management, adolescent development, and parenting skills.